Hello, how you doing, ma'am? My name is Cecilia, a student from TK Murfreesboro. I'm here to do an head to toe assessment on your newborn. Is that okay with you? Then she said yes. Then I wash my hands and I provided privacy. Can you tell me your name and your date of birth, ma'am? She told me. I used her wristband. I make sure I check her wristband. I make sure it matches the newborn wristband. Then I start my assessment by general overview. I want to view the baby. Is the baby sleeping? Is the baby eating? Is the baby crying? If the baby crying, how strong or how weak is the cry? I want to see if there's any sign of distress, respiratory distress on the baby. I want to see if there's any rashes, anything on the baby. Then I go next to my hugger. Then I check the hugger, the appearance of the baby. I check the appearance of the baby. I check the pulses of the baby. I check the baby pulses and I check the grimace. The grimace is the stimulation of the baby. And I check the activities. What is the baby doing now? Is he sleeping? Is he crying? Is he eating? I can see my baby is sleeping. And I check the respiratory rates of the baby. The respiratory rate of the baby is how the chest rise and fall. Then it have to be 30 to 60. I make sure I check that. Then I move to level to my vital sign. I want to check my baby vital sign. But before I start to be exposing my baby, I want to check the temperature of my baby first. Then I check the temperature of the baby, auxiliary temperature. Then I leave it for a couple of minutes until it beeps. When it beeps, I'm going to document my finding. The temperature has to be between the 97 to 99.3. Then I'm going to move next to check my baby weight. I'm going to undress the baby. I'm going to check if the baby have a clean diaper. If the baby have a clean diaper, because the diaper is where it's going to interfere my finding, my reading. So I take the baby for weight. I weigh the baby. I brought the baby back. I make sure I don't expose the baby too much because of the cold. They can easily get cold. So I check the height of the baby. I document the weight by checking the height of the baby. Okay. I measure the baby from the crown of the head to the sole of the feet, and I measure the circumference of the baby on the head. The circumference of the baby has to be between 13 to 15 inches. Yes. I document my finding. I make sure I cover my baby up. But I make sure I check the heart rate of the baby. Then the heart rate, like I said earlier, you have to be 30 to 60. Then I make sure I check the blood pressure of the baby. I use the small blood pressure cuff for the baby. I put it around the arm. Then the systolic have to be between 50 to 75, and the diastolic have to be 30 to 45. Then I make sure my thermometer is, I make sure my I make sure it's clean. I make sure it's clean, and I make sure it's warm. My stethoscope. I check the epical pulse for 4 more minutes. You have to be between 110 to 160. You have to be between 110 to 160. So after checking that, I now start the assessment on the skin. So I make sure I look at my baby's skin. I'm looking for fairness. The fairness is the white protected on the skin. usually be on the baby's newborn. And I'm checking for hematoma. Hematoma is the new capillary found in derma, around the skin, either in derma or subderma. I'm checking for potwin. Potwin is the red, purplish color around the face, and does not blemish. Then I'm checking for the stroke bite. I'm checking for the stroke bite. Stroke bite is the one you apply the pressure on the forehead, on the neck. Then it's the pink color that shows when you apply the pressure on the, and the color does blanch when put the pressure apply. It usually be on the forehead or on the neck. I'm checking the Malasset navel. I'm checking for that. This is for the potential magnet that's called like a node. It's like a node. It's usually come in brown or the black color present. As it might have some hairs too on it. And I'm checking like lagoon. Lagoon is the fire draining hair on the baby head or the hairs. On the baby head or the hairs, here and the body. And I'm checking of acronosis. Acronosis is the blue purplish color on the hands and on the feet during the immature peripheral circulation. So I'm checking for that. I'm checking for eloquent sign. Eloquent sign is the asthmatic flushing. One side will be blush of the body. One side of the body will be blush. And I'm checking for malice. Malice is the white thin bump on the nose and on the cheeks, forehead, and the cheeks. So I'm checking for all that. I'm checking for that. I'm checking for malago. I'm checking for Magonia spots. It's the blush, it's like a blush, gray or brown color at the bottom or sacrum. Yeah. So it's like a, yeah, and it's like a gray or brownish at the bottom or sacrums. Then now I'm going to assess the head. Yeah, I'm going for the head now. So I'm checking for, is there any rashes? Is there any swelling? Is there any lesion? I'm going to check my baby very well. Then I'm going to check for cephalomatomy. I'm checking for the cephalomatomy swelling. I'm checking for the swelling of the head that does not cross the insertion side. I'm checking for that. I'm checking for that, and I'm checking for carpi sudanis. Yeah, the swelling that caused. I'm checking for the swelling that caused during the delivery. Sometimes, the stress of delivering might cause the baby to have the swelling. So now I'm going to the frontal. So frontally, I'm checking for any kind of bulging. I'll first of all check the interior frontal. Sometimes the frontal will close up to 18 months for the interior. And then I'm checking for the posterior frontal. The posterior frontal too might be by 2 months it should be closed. Then I'm checking for station, either is it overlapping, is it separating, or is it approximated. I'm checking for that. Then I'm checking the height now. So I'm going to check the height. I'm checking for the systematic of the height, the color. Is there any redness? Is there any yellowish? If there's yellowish, that means there's sign of jaundice. Is there any drainage or drilling? I'm checking for that. Then I'm checking for the hairs. I'm checking for the symmetry of the hair. I'm checking if it is lower. If it is lower, that it does not be on the right place. There is kind of the syndrome or abnormalities. Yeah, I'm checking for that. I'm checking for the locations. I'm checking is there any drainage coming from the ears. I'm checking for that. I'm checking for that. I'm checking for the, I'm now go to the nose. I'm checking for the flaring of the nose. I'm checking for the tampiness. I blocked one nose. My baby breathed through one nose. I'm checking the other nose. My baby breathed through the other nose. Through the other nose. I'm checking for the mouth. I'm going to check for the mouth. I'm going to check for the mouth. Then, firstly, I'm going to check for the mouth. If they need some sanctioning, I'm going to sanction the mouth, take away all the fluid in there so that my baby will not be aspirate. After checking for the mouth, I'm going to check if there's any presence of the teeth. If there's any presence of the teeth, because that teeth, it have to be noted so that they can take care of, so that my baby will not aspirate on me. I'm going to check for the mucous membrane. Is it pink? The color. I'm checking for the dryness, the cyanosis. I'm checking for that. I'm checking for the soft and the hard plates. I'm checking for the clay plates. I'm checking for the gag reflex. When I check the gag reflex, I'm going to take my clean glove, put in the mouth, and let it go further so that the baby can gag. And I'm checking for the sucking reflex. I'm checking for the sucking. I'm checking for the sucking reflex. I'm checking for the sucking reflex. Two, I want to know if my baby will be able to suck and swallow very well. Then I'm checking the chest now. I'm going to measure the chest. I'm going to measure the chest. The chest have to be like 1 or 2 inches lesser than the head circumference. I'm going to check the chest, so, and I'm going to check the shape. Is it barrel? Is there any distension or anything on the chest? So, and I'm going to check for the ribs, the traction, the sternum, and I'm going to listen to the heart sound. I'm looking to the lung sound. So I'm listening to the lung sound. Is there any sign of crackle? If there's any sign of crackle, it's going to go away between 24 hours. And like I said earlier, the heart sound, the rate should be between 110 to 130. So I'm going to take the heart sound now. I'm going to check the aortic, the pulmonary, the tricuspid, the mitral, and I've already checked the apical pulse. So, and I'm going to check if there's any sign of murmuring in there, and I'm going to check all the pulses. I'm going to check the brachial pulses. I'm going to check the femoral pulses. I'm going to check the pedal pulses. That means I'm going to check dura tibialis or posterior, dura pedis or posterior tibialis. I'm going to check for the capillary refill. It must be less than 3 seconds. I'm going to check for the abdomen. I'm checking the shape. If it's round, is it distended? Is it the dome shape? Due to the immaturity of the baby, but it might be, it should be all be reported. I'm going to check for the abdomen. I'm going to check the umbilical cord. I'm going to check the sternum. So when I check the sternum, I'm going to check for the whitely short gelato with the artery, 2 arteries and 1 vein in there. Any sign of bulging or discharge in there. I'm going to check that. Then I'm going to auscultate the abdomen. I want to check the bowel sound now. I'm going to set is that upperactive or hypoactive sand. I'm going to palpate the abdomen, and I'm going to ask the mom if they have the meconium still, the first still that the baby normally get to get rid of all those cells they've eaten during the when they are in their womb. So if it is a girl, I'm going to check for the genitalias. I'm going to check for the placement of the larva and the clitoris. I'm going to check for the vaginal drainage. I'm going to check for the mucus discharge in the larva. Maybe I'm going to check if there's any swelling. I'm going to check for that. If it is a boy, I'm going to check for the urinary mantles. I'm going to check for the urinary mantles. I'm going to check for the urinary mantles. In the middle of the scrotum, maybe apply large or loose due to the mother hormone. I'm going to check for the palpate the testes. I'm going to palpate it. I'm going to check for the anus, tympanics. Make sure this the anus is well placed. I'm going to check for the neural. I'm going to check for the neural reflex. If there's normal, I'm going to check for the lamb, for symmetry, syndactylis, protactylis. I'm going to check for the rhomb. I'm going to check for the rhomb. I'm going to check for the rhomb. Both of the hand, the leg. I'm going to check for the semicremix, and I'm going to check for the spine. I'm going to check for the spine, the alignment. Is there any dimple? And I'm going to check for the rootning. I'm going to check for the rootning reflex. I'm going to check for the rootning reflex. That's where we touch the cheeks and the baby thinking you want to suck. I'm going to check for the babinting. That's what we do. Yeah. And I'm going to check for the mural reflex. That's why when you put the baby down, it shake. The baby will shake. I'm going to check that. So I make sure my newborn, everything is okay, so that if there's any changes, I'm going to record it and document. So I'm going to document everything, make sure if there's any changes, then we can know what is new. Thank you.